Hey everyone, and welcome back for another deep dive with us. Today we're going to be talking all about exercise and mental health.
Great topic.
Yeah, so we're diving into this research article from the Primary Care Companion to the Journal of Clinical Psychiatry.
Okay.
And it's called Exercise for Mental Health.
Catchy.
Yeah. And this one's for anyone who wants to learn more about how getting active can benefit our minds, whether that's for you personally or maybe for someone you care about.
Right.
So, it seems like there's this growing awareness of the problem of metabolic syndrome and obesity,
Yeah.
especially for people dealing with some serious mental illness.
Mm-hmm.
So what makes this a pressing issue from your perspective?
Well, individuals with severe mental illness are at a higher risk for chronic diseases,
Oh, wow.
like diabetes and heart problems.
Really?
And it's a combination of factors,
Right.
like inactivity and medication side effects.
Oh, I see.
And sometimes the conditions themselves can contribute to these issues. That's why lifestyle changes become crucial for this population.
So it's not just about getting in shape physically.
Exactly. The article highlights how exercise can actually act as medicine for our minds.
Interesting.
Aerobic exercises like jogging, swimming, or even just gardening can have a pretty significant impact on reducing anxiety and depression.
Oh, I love that you mentioned gardening.
Yeah.
Because it reminds us that it doesn't have to be about some intense gym workout or anything.
Right.
But I'm curious about the science behind how moving our bodies can lead to feeling better mentally.
One key is how exercise boosts blood flow to the brain.
Okay.
This increase in circulation impacts our HPA axis.
HPA.
Yeah, our body's central stress response system.
Oh, okay.
Ever notice how your stress kind of melts away after a good workout?
Oh, absolutely.
Yeah.
But I always wondered if that was all in my head.
It's not just in your head.
Okay, good.
When we exercise, our brains release these neurochemicals, including endorphins, which have mood-boosting effects.
Interesting.
Plus, exercise influences the production of cortisol, which is a key hormone related to stress.
Got it.
And by regulating those cortisol levels, exercise helps us manage stress more effectively.
Wow.
And this all ties back to those changes in brain regions like the limbic system, amygdala, and hippocampus.
Lots of big words there.
Yeah, but they're all involved in mood regulation, fear, and memory.
So it's like exercise is helping to rewire our brains to handle stress and emotions better.
Exactly. But it's not just about mood.
Okay.
Exercise can also improve self-esteem and cognitive function, which are especially important for individuals facing challenges like schizophrenia.
That's a good point. And the article mentions this study where schizophrenic patients saw improvements in not only their weight and fitness, but also in their hand grip strength
Wow.
after just a 3-month exercise program.
That's amazing.
Yeah, so that seems like a pretty powerful testament to these positive ripple effects.
Absolutely. And the fascinating part is that you don't need to be training for a marathon to reap these benefits.
Wait, so I don't need to push myself to the limit every day?
Not at all. That article emphasizes that just 30 minutes of moderate activity, even broken up into smaller chunks throughout the day, can make a world of difference.
So even something as simple as a brisk walk or dancing around the house can have a positive impact.
Exactly. It's about finding ways to make movement a sustainable part of your life.
That makes so much sense because I think a lot of people get intimidated by the idea of having to commit to these long, intense workouts.
Right. And that can be a major barrier for many people, especially those who are already struggling with mental health challenges.
Yeah.
What's important is to find activities you enjoy and can realistically fit into your routine.
So it's about finding the joy in movement, not just focusing on the physical exertion.
Precisely. And the great thing is the benefits of exercise extend far beyond mood regulation.
Okay, I'm all ears. What else can this wonder drug do for us? Hashtag TTS, the deep dive episode 2025-0103, part 2 of 3. Well, for starters, regular physical activity can really improve your sleep quality.
That's a big one, especially for people who struggle with insomnia or other sleep disorders. Better sleep can lead to a bunch of positive effects on mood energy levels and even cognitive function.
I've always wondered about the link between exercise and sleep. It seems kind of counterintuitive that tiring yourself out would actually help you sleep better.
It might seem that way, but the research is clear. Exercise helps regulate your circadian rhythm, your body's natural sleep-wake cycle. And by reducing stress and anxiety, exercise kind of sets the stage for a more restful night.
And the article also mentioned some other pretty interesting benefits, like increased energy and a boost in libido.
Yeah, and those benefits really highlight how interconnected our physical and mental health are. When you exercise, your body releases endorphins, which can have a positive impact on your mood and even your sex drive. It's like a positive feedback loop. Exercise makes you feel better mentally, which in turn can improve your physical health and well-being.
So it's not just about addressing specific symptoms. It's more about cultivating a sense of overall well-being.
Exactly. And that brings us to another key point. Exercise is incredibly accessible. You don't need fancy equipment or a gym membership to get these benefits.
Right. Earlier you mentioned gardening. What are some other examples of everyday activities that can count as exercise?
Walking is a great one. Even a brisk 10-minute walk a few times a day can make a difference. Taking the stairs instead of the elevator, dancing around your house, playing with your kids. All these activities add up and can contribute to your overall physical and mental well-being.
I love how you're reframing exercise as something that can just be part of our daily lives rather than being this separate, daunting task.
It's about shifting our perspective and finding opportunities to move our bodies in ways that we enjoy. And speaking of enjoying exercise, let's talk about motivation.
Right.
I know that's a challenge for a lot of people.
It is. It's easy to get all excited about the benefits, but actually sticking to an exercise routine can be tough. What are some strategies people can use to stay motivated?
One key is to set realistic goals. Don't try to do too much too soon. Start with small, achievable goals and then gradually increase the intensity and duration of your workouts as you go.
So instead of aiming for an hour-long gym session every day, maybe start with like a 15-minute walk 3 times a week.
Exactly. And another important tip is to find an activity you actually enjoy. If you hate running, don't force yourself to run. Explore different options until you find something that makes you feel good, both physically and mentally. Maybe it's dancing, swimming, hiking, or joining a sports team. There are tons of possibilities.
It sounds like the key is to just make exercise a positive experience, not a chore.
Right. And don't be afraid to get some support. Find a workout buddy, join a fitness class, or even just tell your friends and family about your goals. Having that accountability and encouragement can really make a difference. And don't forget to celebrate your progress along the way. Every step you take is a step in the right direction.
It's so inspiring to hear you talk about exercise with such passion. But are there any potential downsides or risks associated with exercise, especially for people dealing with mental health conditions?
That's a really important question. While exercise is generally safe and beneficial, it is important to listen to your body and consult with your doctor, especially if you have any underlying health conditions. It's also crucial to start slowly and gradually increase the intensity and duration of your workouts.
So it's always a good idea to get personalized guidance from a healthcare professional. But overall, it seems like the potential benefits of exercise for mental health are much greater than any risks.
Absolutely. And it's not just about individual benefits. The article really pushes for incorporating exercise into mental health treatment plans. It suggests that mental health professionals should be actively advocating for exercise as part of a holistic approach to well-being.
That makes so much sense. It's like we have this readily available, powerful tool, and we're not fully utilizing it. What are some of the reasons why you think exercise is often neglected in mental health care?
That's a tough question with a lot of layers. There's still a stigma around mental illness, and some healthcare providers may not fully understand how much of an impact exercise can have. There are also practical barriers like limited access to fitness facilities or a lack of resources for patients who can't afford gym memberships or personal trainers.
It sounds like there's a real systemic challenge here.
Yeah, and it's going to require a bunch of different approaches to address it. We need more research to really understand how exercise benefits mental health. We need to educate healthcare providers about how important it is to make exercise part of treatment plans. And we need to push for policies that make exercise more accessible and affordable for everybody.
It's like a call to action for all of us individuals, healthcare professionals, policymakers, to prioritize exercise as a key part of mental well-being.
Exactly. By recognizing how powerful of an impact exercise has on our minds and bodies, we can create a healthier and happier society.
Well said. This has been such an eye-opening conversation. It's really made me rethink my own relationship with exercise and its impact on my mental health. Now, before we wrap up, I want to go back to something you mentioned earlier about the stigma surrounding mental illness.
Yeah, unfortunately, there's still a lot of misunderstanding and prejudice around mental health issues. This can prevent people from seeking help or talking openly about their struggles.
And I imagine it can also make it even harder for people to prioritize their well-being, including making healthy choices like exercising.
Absolutely. Stigma can create a sense of shame and isolation, which can make it really hard to take those first steps toward positive change. It's so important that we keep working to break down these barriers and create a culture where people feel safe and supported in seeking help and taking care of their mental health.
And I think that's a powerful message to end on. We all have a role to play in creating a more compassionate and understanding society when it comes to mental health.
Definitely.
Yeah.
And remember, taking care of your mental health is just as important as taking care of your physical health. Exercise is a great tool that can help you do both.
This has been a really insightful deep dive. I know our listeners are going to get a lot out of it.
I hope so. It's been a pleasure sharing these insights with you and your audience.
And a huge thank you to you for joining us today and sharing your expertise. Now, for our listeners, we'd love to hear your thoughts on this episode. What resonated with you? What are some of the challenges you face when it comes to incorporating exercise into your routine? And what are some of the things you do to stay motivated and make movement a joyful part of your life? Hashtag TTS, the Deep Dive, episode 2025-0103, part 3 of 3. We're all in this together, and sharing our experiences can be really helpful for everyone.
Absolutely. And remember, even small changes can make a big difference. You don't have to become a marathon runner right away.
Right. You were saying earlier, like, even a brisk walk a few times a week.
Exactly. And as you keep doing it, those small steps can turn into bigger changes and lead to a better feeling of well-being.
It's about progress, not perfection.
Right.
Well, I think we've covered a lot today. Any final thoughts you want to leave our listeners with?
Yeah, just remember that exercise isn't just about physical fitness.
Right.
It can really help boost your mood, lower stress, improve how your brain works, and just make your life better overall.
And it's easier to get started than you might think.
Exactly. So get out there, move your body, and see how much exercise can change things for you.
I love that. Such an inspiring message. Thank you again for joining us and sharing all these insights.
It's been great.
To everyone listening, thanks for tuning in to the Deep Dive.
Yeah, thanks for listening.
We hope you found this deep dive into exercise and mental health useful and empowering. Remember, taking care of your mental health is just as important as taking care of your physical health.
Yeah.
And like we talked about today, movement is medicine. Until next time, keep exploring, keep learning, and keep moving.